So good day everyone, most especially to our dearest audiences listeners. We are here to discuss our research paper and it's all about Malunggay Organic Vaccine for COVID-19 viruses and also known as MOV or MOV. And this study proposed an invention of soluble tablet vaccine that aims to develop an organic, affordable, and effective vaccine for COVID-19 with the help of biotechnology. And this research will not be possible without the help of the team members. And the people behind this research was starting with the member number 1, Mr. Awitin, member number 2, Ms. Isona, member number 3, Mr. Liu James Adrian, and lastly, member number 4, the team leader, Ms. Lumibao coming from the section 16294. And this was submitted to Ms. John Monique Engbino, our Science and Technology Proctor. So without any further ado, let's all witness the discussion of our papers for the further information and possible outcomes that our researchers has made, and what will be the contribution of it in our society, starting with the project rationale to be discussed by Mr. Liu and to be followed by the rest.
So for our project rationale, in the past, people did not pay much attention to social distance. But with the outbreak of the epidemic, people should pay more and more attention to social distance. In order to reduce the infection rate, people need to maintain social distance no matter in the food market, supermarket, or anywhere. However, due to the various reasons, people cannot maintain long time of social distance, which leads to the rise of infection rate, which has brought great harm to the society. In order to solve this problem, biological companies all over the world are starting to develop vaccines. During the vacuum period of vaccine development, how to reduce the virus infection rate has become the top priority. This is also our goal. We will develop MOV based on biotechnology, a vaccine with drinkable soluble tablets so as to improve the immunity to the virus and reduce the infection rate.
Next, related literature.
Now, for review-related literature, I am going to stating our finding from existing literature relevant to our project invention. But before that, I personally introduce myself. I am Rio Awitin, the researcher of this project. COVID-19 is a newly discovered infectious disease, namely coronavirus. It's begun in Wuhan, China, and now has escalated into worldwide pandemic. In order to solve this various problem caused by this pandemic, and we will going to invent a malunggay soluble vaccine, which is our proposed solution, which is a simple technology for preparing instant dissolving tablets. According to WHO or World Health Organization, the COVID-19 pandemic has resulted in over 30,000 deaths globally, with over 600,000 confirmed cases of March 29 to 2020. The United States had reported 85,991 cases as March 27, 2020, standing as the nation with the highest COVID-19 reported cases. Concerning global health problems or systems, COVID-19 is not only a problem but also a test of our human spirit. Recovery must lead to an equally resilient world for future crises. In many countries, fiscal stimulus packages and emergency actions have been put in place to address public health gaps to mitigate COVID-19 effects. That's why vaccines are highly effective in reducing illnesses, death, and disability. One of the most compelling success stories of vaccine is the eradication of smallpox, the debilitating disease that killed more than 300 million people in the 20th century. More than twice than that toll of all military wars in the same period. Vaccination programs need continued support with proven strategies and fresh approaches to reduce the incidence or the diseases that may be prevented through traditional vaccines and permit the effective introduction of new vaccines. Thank you.
Okay, next, the objectives and expectations. So this will be discussed by me. But first, I will going to introduce myself. I am Joanne Lumibao, the team leader of this research project, and the objectives and expectations will be followed by to develop new and improved vaccines, to support the development of our solution, to manufacture and develop a new vaccine to prevent infectious diseases, to enhance the process of developing or making technological innovations of new effective vaccines, maintain immunization for people including elderly, pregnant women, infants, and children to help not directly infected with the diseases, to ensure preferable, highly affordable products to sell to help the needy people that can't afford the expensive vaccine, and lastly, to enhance immunization to strengthen safety of the people and reduce the case of the diseases. So, to the project description.
Good day, ma'am. For the project description, I am Isona and I am going to discuss with this point. So in today's hardships, with the cause of the coronavirus or the COVID-19, we are applying solutions to the problem that we have to face today. The team will invent a malunggay organic vaccine in which it has a simple technology and is also accessible for preparing instant dissolving tablets. We made it accessible for the community. With this, for this project to be successful, we somehow need people who knows and benefits from this invention. We have the core team, the biotech team, the media team, the medical team, and lastly the sponsors. As we witness these project objectives, or we have already knew the project objectives, we need to implement the steps to follow the plan to succeed in the formulation of malunggay organic vaccine. We have here to gather together with the core team and create a plan. Second, we need to assign the different members their tasks and roles. Third, we have to coordinate with the people to be involved in this project. And fourth, the finalization of the plan that is somehow implemented. Fifth, we have to assist and keep track of the vaccines. And lastly, we have to check if the vaccines that were invented were effective or evaluated.
Okay, thank you for the members of the team. So our research we needed help for the core teams. Help is needed where this involves us as the one who creates and implements the said project and is responsible for this event. Second, the biotech team. It helps us to make possible vaccines and guides and uses some of their possible equipment for our vaccines. We also have the media team, which helps us to cooperate and to inform us of the following reports and pieces of information about the updates of coronavirus disease COVID-19. The medical team, the people involved in medical work such as doctors and some other medical professionals, help us introduce and promote our vaccines to the people or patients who need to take vaccines at a low cost. And then lastly, the sponsors to help us have the ideas and needs of making vaccines and making this invention successful and to make it more possible. So, we're going to move forward in our references. So, Mr. Liu.
For our references, we have got it from 球在战胜疫苗中发挥科学中关键作用求是网 from February 10, 2020.
Next, Mr. Awitin.
Okay, we got the next references to coronavirus diseases 2019 or COVID-19, a literature review from May 1, 2020 from PubMed Central PMC www.ncbi.nimni.government PMC articles.
Okay, for the another references, we've got it from the Adhikari SP, a literature review of the 2019 novel coronavirus during the early outbreak period, epidemiology, causes, clinical manifestation and diagnosis, prevention and control. Lastly, Miss Isona.
So for the last references, we have Yarmaliza Y, 2020, June 7, literature review of epidemiological phenomena, coronavirus disease pandemic 2019 by European Journal of Medical and Health Sciences.
Okay, so this ends our discussion summary of our paper in which we're hoping for ideas as a researcher to be discovered and approved by the professionals and also help the improvement of our future vaccines and solutions for the society. Thank you and God bless.